0, 1.
Hey everybody, we are back again. This is like our 4th or 5th episode, but today we are not at Houndstown. We are at Dogwood, and I'll let our guests talk about Dogwood. And they've been so great to us in a lot of ways, and so we definitely wanted to bring them on and have some conversation about some of the resources, the awesome resources that they provide for our pets.
Sure. Yeah, so I am Dr. Bridget Wilson. I am a veterinary behavior resident here at Dogwood. We recently opened a behavior service, and essentially here at Dogwood we see all sorts of animals. I mean, we're known for our emergency department. We have some different specialties as well, but behavior is the new specialty that has come up. And we see all sorts of animals. So we see dogs and cats primarily, and typically we see reactivity, aggression, separation anxiety. For cats, we see a lot of like urinating outside the litter box, inner cat aggression, inner dog aggression, all of those sorts of things.
Yeah.
We can get into some compulsive behaviors as well, so like chronic tail chasing and all of that. But that's kind of what we do in the behavior service. It's a lot similar to like psychiatry in humans.
Explain to us, like, because I know as new pet parents, we may see some of these things happening, and we may not. I mean, are they genetic? Like, how do these things happen? Or, how do they happen? And what do we look for?
So all animals, just like people, we have a window of tolerance for different things, and that can be based off our genetics, so what our mom and dad are like. That can be based off of the socialization window, so when puppies or kittens are really young, things that they're exposed to or not exposed to can make a lasting impact in their brain. The stress that they have as young animals can affect the tolerance that they get as they grow older, and then just their learning history. So depending on the experiences that they've had, if they've had any traumatic experiences like major health issues when they were younger, things like that, that all plays into the way that they cope with stress later in life.
This is so similar to humans.
It's exactly the same as humans. And it's really crazy because then once we get to the state where we're stressed out, it's the same sort of process in our brain. So as humans, when we get stressed out, same for dogs and cats, we jump into fight or flight mode. And when we're in that mode, our prefrontal cortex breaks down, and that's the part of our brain that's responsible for rational decision making, logical thought, all of those sorts of things. And that's why we kind of overreact and jump into a state of maybe using aggression or other things. It's not a conscious choice, but it's just our body reacting to the situation.
And there is a resource for these things. I think it's important for people to know that if something is triggering something with the pet, that they can get help, and we don't have to surrender them. We don't have to give them away. We can find resources to get them the help that they need. Now, in many cases, are these healing situations? Like, can you stop what's going on with the animal if they are able to leverage like the resource or a treatment? You put together a treatment plan for them?
Sure. Yep, exactly. So it depends on the cause of what's going on. A lot of times there are medical contributors as well to behavior. So if we are feeling bad, and pain is a big one, we can fix those things, and then that can solve some of their behavior problems as well. Some of the things that are more genetically linked, they are always going to exist, but there are lots of things that we can do to improve that behavior over time. So we kind of have a 3-tiered process in our treatment plans where we talk about safety and managing the environment to kind of set the animal up for success. Then we'll talk about behavior modification, which is essentially training them either to have alternative coping skills than the ones that they're using already, or we can do things to change their underlying emotion from fear or stress to something more positive. And then we can talk about medication as well. Some animals need medication to feel better and to kind of regulate their nervous system. So we can use medications in those moments to better help us with the training.
Yeah.
to make it all better.
What do you see, like, what is there something that's more common than other things? Or I know in the daycare environment, the two most common medicines we see are gabapentin and trazodone, I think.
Yep.
And what are they for? And like,
Sure.
is that, I know you talked about anxiety and stress. I can imagine that that's maybe why these pets may be taking those
exactly.
treatment or those those medicines. But is that what you see most common is like pet anxiety or?
Yeah, I think that probably for dogs, the most common thing I see is just kind of the generic reactivity.
Yeah.
So whether that be barking at other dogs, people, scared of people on leash in the house, those sorts of things. And reactivity is kind of a broad general term that could be anxiety, it could be fear, it could be a number of things. Sometimes, especially in our like pity breed mixes, a lot of times it's like overexcitement, over arousal that can turn into more like reactivity. So that's the most common thing I probably see for dogs. And then trazodone and gabapentin are two of the many medications that we can use to help with those. So those tend to be more situational medications. They're meant to be a little bit calming, a little bit sedating to help them get through stressful events because boarding can be stressful sometimes, so they might need help with that. And then we also have more daily medications for pets that are struggling with generalized anxiety or daily triggers. We can have medications more like Prozac or other forms of meds to help them just kind of settle on a daily general basis as well.
Are these meant in some cases to be like short term, or in some cases will they become a part of a dog's life?
Yeah.
I'm sure there are cases for both, but
yeah, exactly.
You know, that's something that you would help determine as a specialist, right?
Exactly. So if we start an animal on a daily medication like a Prozac or another SSRI, we often use the same ones that we use in humans. I always like to get them to a point where we feel stable. So we get them to a point where they are feeling good, feeling much better, able to focus on things, not having any problems. At that point, we can try to wean them off the medications. Sometimes they do great when we wean them off the medications, and that is just a sign that they needed help short term. Sometimes when we start to wean them off the medications, they get worse, and that's a sign that maybe they need it lifelong to be healthy and happy. And in those situations, that's totally okay because we don't expect any negative side effects lifelong. It shouldn't affect any of their organ systems. It shouldn't affect their lifespan or anything. And we also only use medication to help the animal with how much they need. I'm never giving medications to change an animal's personality or to over-medicate and sedate them. That's not what we want because that's not why we have pets. So I always want to make sure that I'm only giving the amount of medication that the pet needs to be happy.
Good. Now you talked a little bit about like the socialization window, which is very important for dog daycare. Is that such a thing? Like, I know you hear it, but is there a window that dogs do better, well, in our case, if they're socialized earlier than later? Is it possible if they're on the older side to be socialized when they're older? Or from a medical standpoint, expert, like tell us what the deal is with that.
So that's one of the most common misconceptions that I hear people say is that if their adult dog is maybe anxious around other dogs or doesn't get along well, that they just need more socialization. And that is not real. So socialization is a very specific window of time. For dogs, it's between 4 to 14 weeks old. And during that time, the brain is developing in a certain way that every experience that they have really matters. So at that point in time, so when they're, a lot of times before we even get them as owners, they are figuring out what is safe and what is unsafe. After they grow out of that, their brain is a lot more solid in those beliefs. They can be changed. We can do things to change them. It just takes time and effort. So if we throw an anxious adult dog, I mean, essentially that's kind of what I do is dog therapy. But if we throw an anxious adult dog into maybe a daycare setting when they are nervous around other dogs, that will just worsen their fear overall, and it can be dangerous. That's when we see dog fights and things like that. So the best thing to do in that situation is work with a trainer, or potentially even come see me if there's maybe some medical or medicine that they need for it, to get them more comfortable before we introduce them to other dogs.
Yeah.
Because ultimately, social time is important, but it doesn't have to be social time with dogs. It could be social time with the pet parents.
Yeah.
It all depends on what that dog is comfortable with.
Yeah, absolutely. I 100% agree with you. I think, you know, one of the things we try to make sure we're, you know, cultivating is a safe environment.
Yeah.
And sometimes that means we have to say no to some dogs. A lot less than, you know, you would think, but it doesn't mean that that dog is a bad dog. It doesn't mean that that dog can't go and be social in other environments, which is why it's important for them to know, pet parents to know, okay, what, you know your dog situation, and here are resources that can help improve that dog's quality of life, right? Ultimately, that's what we want. That's what I want, you know, regardless of the space. You know, I'm in the dog community space, but I'm a dog lover. So I want to see dogs thrive at the highest possible. I want them to see this, them go as high as possibly they can possibly go. You know, and live their best. Hopefully 30 years, but we know that doesn't happen.
Maybe we'll get to that point. Yeah, I think one of the things that I always tell my patients is dogs don't have a moral compass. They don't know right or wrong. So when they use aggression in certain situations, they're just communicating that they're uncomfortable with their environment. And so it's important that we listen to that so that we don't escalate in those situations.
Perfect. Now, talk to us a little bit more about Dogwood. I know, like, what is important for people to know is Dogwood's 24 hours, right? I think that's huge for people to know. But talk to us more about, you know, where you're located. What are some of the other services you provide? And I can tell you, I had a personal experience that was great here with my dog. So I can vouch for everything that Dogwood does. It's wonderful. But tell us more about, you know, everything else.
Yeah, Dogwood is a 24-hour specialty clinic, an emergency clinic. So we're located in Marietta, Georgia, and we're having a second location. I don't know if I can say that. Okay, well, the spoiler is out. We're opening a second location in Dunwoody as well. So we're about to have two different locations, one in Marietta, one in Dunwoody. Both of those will be 24/7 emergency clinics. So anytime your pet needs something, day or night, you can come in and we can help you. We have a team of board certified specialists in emergency, and then also some really dedicated emergency doctors specifically that can help in those situations and save a lot of lives. And then once they're stable, we also have a team of internal medicine doctors. We have a team of surgeons. We have some other specialties as well, like oncology, radiology. We're going to start having neurology, dermatology, all of the ologies, any of the things that you could possibly need. Dogwood has a specialist, so it really results in the most collaborative care that you can get and the best care, because no matter what your pet is struggling with, there's someone who is an expert in that and can help them.
So to help people, like, bring it full circle, so maybe their regular vet is just general practice and exams, and you're more specialty. Is that kind of the best way to?
Exactly.
Perfect.
So just like humans, where you have an emergency department, that's kind of what we are, where we have our emergency room doctors. And then if you need something, you typically, as a human, get a referral to that specific specialist. And so Dogwood is going to have all of those specialists kind of under one roof. The referral system is different in veterinary medicine than it is in human medicine, but it's the same sort of thing, where we have specialists who they go to vet school, and then they do an internship, and then they do a residency that is specifically focused on whatever their specialty is. So people are very smart, and we have the kindest people here. I will say that the people and team here care about the animals that we treat more than any other place that I've worked.
That's good. And that's good for pet parents to know. This channel is all about resourcing pet parents, and I'm happy you were able to spend a few minutes with us today, talk about what it is you do. How can people contact you? Tell them.
So if you want to have an appointment with the behavior service, we have a few different ways to do that. You can call our front desk. Phone number is 404-609-1234. I have it memorized now. So you can call our front desk and they can give you information about an appointment. You can also go on our website. So the Dogwood has a behavior specific section of the website, and on there you'll find our intake forms for both dogs and cats. And if you fill out that form, it will initiate, it will send to us, and then we will reach out to you to schedule an appointment and do all of that. And then your primary care veterinarian can refer to us as well. So if you're working with your normal vet, you have some issues that maybe they can't deal with in the time span that they have, they can refer to me that way as well.
And of course, we have information too for pet parents. Again, you all have been great partners for us. We tell everybody, they want to know when they come to boarding or daycare, what do we do if there's an emergency? And we always recommend Dogwood, right? So that gives them comfort and, trusting us with their babies, because we trust you with their babies as well. So it's all about, for me, making sure that we can, build strong communities of resources for people, and they feel good about the decisions that they make when they have a pet, a dog or a cat. And again, like I said, I didn't know you were here when I first got my dog. So when we had an emergency, 11 o'clock at night. So, those things do happen for pet owners, and it's great, for me to have this conversation with you, and then have you, tell your story about what it is you provide, and for them to know that the services are there for their dogs. So thank you for coming on.
Thanks for having me.
Channel. And we'll close it out. All right.
Sounds good.
Okay.
Cool.
There's one unique point we forgot to mention about Dogwood. Okay, go ahead, tell us.
So for our emergency department, like I said, we have emergency doctors and then board certified critical care doctors as well. And we are the only facility in Georgia with 5 board certified criticalists. And we have 1 on staff at all times, so 24/7. So when your patient is coming in for an emergency, we have someone who is extra specialized in emergency care here all the time to help you out.
That's great. This is why we use them. Peace.